Hi, my name is Amelia, and I will be discussing about orthopedic impairment. An orthopedic impairment is defined by IDEA as a severe orthopedic impairment that adversely affects a child's educational performance. IDEA specifies that this term includes impairment caused by birth defects, disease, and impairments from other causes. Although IDEA uses the term orthopedic impairment, educators typically use the term physical disabilities when referring to the same condition. Physical disability is a condition that interferes movement, such as motor control, fine motor control, and oral motor skill. Students with an orthopedic impairment usually have a history of chronic disability and were diagnosed through routine doctor visits as infants and young children. In addition, students who have permanent injury involving muscles, joints, and bones usually have been receiving rehabilitation service. For the prevalence of orthopedic impairment, according to the U.S. Department of Education, orthopedic impairment represents approximately 1% of all students having a classification in special education. Children who experience physical disabilities can also have neuromotor impairments, such as skeletal system, joint, muscle, or limb disabilities, and qualify for IDEA. Neurological and orthopedic disability are two distinct forms of disabilities. However, they both cause similar limitation in movement, and there is a close relationship between them. It is difficult to make generalization about the characteristics of students with orthopedic impairments because IDEA category contains such a wide variety of disorders. However, some common characteristics include paralysis, unsteady gait, poor muscle control, and loss of limb. Orthopedic impairments are often divided into two main areas. These are neuromotor impairment and musculoskeletal disorder. A neuromotor impairment is one that has caused damage to a child's spinal cord, brain, or nervous system. A neuromotor impairment can be acquired either at or prior to the birth of a child and often results in the complex motor issues that may affect a number of their body systems, such as limited limb movement, a loss of appropriate alignment of the child's spine, or loss of urinary control. Two of the most common forms of neuromotor impairment include epilepsy and cerebral palsy. Epilepsy is a condition of recurrent convulsion caused by abnormal brain activity. It is treated with medication and frequently is well controlled without any effect on learning and motor skills. Meanwhile, cerebral palsy is an incurable and non-progressive condition caused by a brain injury that limits the individual's ability to control muscle groups or motor functioning in specific areas of the body or sometimes the entire body. Musculoskeletal disorders are comprised of a number of conditions that may result in varying levels of physical limitations. However, the cause is not neurological. Examples of musculoskeletal disabilities include limb deficiencies and juvenile arthritis. Limb deficiencies is a condition where individual limbs might be shortened, malformed, or absent due to the congenital condition or accident. Juvenile arthritis is a condition caused by autoimmune process resulting in swelling, immobility, and pain in joints. An evaluation is required for a disability to be classified as an orthopedic impairment. While the exact requirements for such evaluation vary by location, this process generally includes a medical assessment performed by a doctor, detecting how the impairment may impact a child's academic performance, and observing the child in his or her educational atmosphere. Considering the diversity in conditions that are included in the orthopedic impairments category, educational challenges will differ case by case, and the strategies used in each case should focus on a student's unique needs. These are some problems that students with an orthopedic impairment might face in the classroom. Non-accessible transportation, trouble maneuvering around the classroom, difficulty navigating school hallways, earning mandated physical education credit, and communicating effectively. Many students with an orthopedic impairment have no cognitive, learning, perceptual, language, or sensory issues. However, individuals with a neuromotor impairment have a higher incidence of additional impairments, especially when there has been a brain involvement. For most students with an orthopedic impairment, the impact on learning is focused on accommodation necessary for students to have access to academic instruction. Here are some of the strategies that teachers can use to support students with an orthopedic impairment. Students with an orthopedic impairment might have assistive technologies that allow them to communicate, read, record, notes, or physically move around the room. Collaborating with the student support team, such as their family, IEP team, and therapists, can help teachers to learn how these technologies can be incorporated into classroom activities and instruction. Classroom teachers should also collaborate with the special education teacher in order to provide appropriate modification to tests, quizzes, and other assignments. For example, a student might be better able to respond to a question orally rather than writing a response or using assistive technology. Besides that, the number of questions can be reduced if the student tires easily. A child in a wheelchair or a child with a spinal problem may require some special chair or table. Discuss these issues with the parents. If the child is finding it difficult to sit on a regular classroom chair, it will be worth considering getting a special chair for him for the classroom. The child will be spending a lot of his time every day in the classroom, and if a child is not seated comfortably, learning and writing can be very difficult. Accessibility of the classroom is one of the important issues to consider. If the child is in a wheelchair, the class should be accessible by wheelchair. The teacher also needs to check if the flooring is adequate for the child's needs. Toilet accessibility is another important issue that needs to be considered. If the classroom is not suitable, the teacher might need to consider renovation or shifting to a different room. A classroom is a place made up of students and not their disabilities. The greatest barrier to inclusion is usually not architectural. It is often teasing and exclusion by peers. Therefore, the class needs to be prepared to receive and include a child with an orthopedic impairment. Teachers need to talk about how they need to care for and treat the child. Talk about how the child is just like them and have feelings too. Many of the children with an orthopedic impairment have normal intelligence and do not need a special curriculum. What they need from us is just acceptance and a little adjustment.